Growing up, my mom and my grandmother said, Marilyn's going to be the nurse. They bought me every Cherry Ames book, which is like a Nancy Drew. It's a Cherry Ames series. I read all of those series. And I always knew I was going to be a nurse. There's nothing else that I'd rather do. I wanted to work here in Franklin Square because I had done some training here and I live in the community. I first started in med-surg. I worked in a med-surg floor for 2 years and I loved that job. And then I got married and I had a baby. Came back at what was called PRN. So I worked all over the hospital. I really got a lot of experience. I became a nurse. I said that's when I really became a nurse because I worked so many places. But one of the places I worked was OB. And I realized I really liked that. And labor and delivery, it was my favorite job, and I loved it because it's such an intimate moment for you to work with a person, with your patient, because she's vulnerable, but then she trusts me. That's my job. My job then was to reassure her, but then to be knowledgeable and take care of anything that could happen. And all of a sudden, there's another person in the room. The baby's born, and it was just beautiful. That's why I think it was my favorite job. Well, there's so many changes as a nurse in the nursing, the work, everyday work, different equipment. We have much better equipment now. We used to have these little Gomco suction machines that we would roll in to do suction of a patient. It was called a Gomco. Now the suction machines are in the wall. We used to have glass IV bottles. Now we have their plastic bags. We used to smoke in the nurses' station. I mean, so many things have changed. We have medicine rooms. We used to have to go in the room, lock the door behind you, and draw up your medicines. And now they're in a Pyxis, they're in a locked cart. It's just a lot of changes. We used to have 4 bedrooms, 4 patients in a room. There was no privacy. Now we have all private rooms. One of the main differences from back in 1972 when we started, actually I think now nurses have more respect. Back then, when the physician would walk into the nurse's station, if you were charting, you stopped, you closed your chart, you gave it to the doctor, you got up, gave him your seat. But now we're collaborative. And I really appreciate that. The doctors call me to discuss their patients. What do you think I should do? What do you think we should do? How should we manage this? And we collaborate together. And I just like that respect that we have for each other. We've come so far. And one of the things, we have the Cancer Institute. We have the Orthopedic Institute. We have top-notch NICU here. We have a whole women's pavilion for obstetrics. We are certifying a stroke hospital. So we've come a long way. I mentor nursing students throughout the year, and I tell them all, I can't imagine not being a nurse. And I tell them that they're in for a good career if they're caring, they're honest, and compassionate.